Welcome back to The Doctors. Studies show that approximately 2 out of every 5 college students have engaged in binge drinking. That's a pattern of heavy alcohol use. Obviously, it can lead to very serious consequences. And after a night of heavy drinking, the road for one college woman didn't end as planned.
It was recently reported that a 19-year-old college freshman was found unconscious hours after binge drinking between 10 and 17 vodka drinks in a 2-hour period. She was later pronounced dead at the hospital. Her parents believe that the people serving the alcohol to their underage daughter should be held responsible.
You know, first and foremost, this is a tragedy. And if us covering this on the show can prevent one more needless death from not happening, then I'm glad we're doing it. But one thing that everyone has to understand out there, particularly true for young women who may be more naive to alcohol and they go to a party, when you drink this much hard alcohol in a 2-hour window, your body does not have time to metabolize that alcohol to a safe level. And the blood alcohol level, it continues to climb. And when you take a drink, it can take anywhere from 10 to 15 minutes for it to really get into your bloodstream and do the quote-unquote damage that we saw in this piece, or presumably happened in this piece. Which is why if you're doing shot after shot, you can theoretically get in 5, 6 shots in 10 minutes. And that 6th or 7th or 17th shot could be the last one you ever have.
And what happens a lot is, as women, we can do just about anything a guy can do. And so when we're out partying, we want to party just as hard as our guy friends. And the problem is that you can't. That is just one time you can't keep up, and you'll do the same shots, and you'll get drunk faster, and things like blackouts can happen where you do things you don't even remember, which can lead to unprotected sex. It can lead to date rape. It can lead to drinking and driving. It can all lead to death. And it's, it's
somebody
really
can slip
dangerous.
something in the drink, and I couldn't agree with you more, but it's so tough because you want to be sociable.
Yeah.
The mistake that was made, and is made so frequently in cases like this, the mistake was when you leave someone, when they're seriously inebriated and they are no longer protecting their airway. You can never just lay someone in their bed and say, oh, they'll sleep it off. They will not sleep it off. They will potentially die. When someone is not responsive, when someone is not protecting their airway, you don't put them to bed, you take them directly to the emergency department or call 911. Don't ask questions. I don't care if you're drunk or not. You make that call, get help on the way, because that's when people die. You put them in a corner, let them sleep it off. Well, that does not always happen.
Because they can aspirate, they can do all,
Yeah.
and they can stop breathing. It's kind of very scary. But
So-
just the more we can educate our kids about the potential dangers, and kids can try and use good judgment.
17 shots. Anyone in college watching this show, 17 shots in that period of time can kill you. So now you know, personal responsibility. You may not be 21, but you have the personal responsibility to know this many shots can kill you. And don't forget that, and don't give in to peer pressure, most certainly. But of course, in this particular instance, our hearts go out to the family of that young woman who passed. Well, as we know, binge drinking, it has serious side effects, including, though, one you would never expect, and it's for women on birth control.
According to a 14-year college alcohol study from the Harvard School of Public Health, 45% of students in 4-year colleges engage in binge drinking. One little-known side effect of binge drinking is that if a woman vomits within 30 minutes of taking her birth control pill, the effectiveness of the pill may be compromised or even canceled.
Yeah. That's another consequence from binge drinking, is that you can have an unintended pregnancy. When you're drinking, you can forget or you can throw up. That makes them less effective. This can also happen if you take certain medications. Very few antibiotics, but certain antibiotics can interfere with birth control pills, and you have to be careful about mixing those as well.
And alcohol can interfere with beyond birth control pills, other medicines. The alcohol interferes with their metabolism. So it's just another good reason not to overdo it. Thank you, Dr. Lisa.
Hi, I'm Dr. Tracy Marks, here to talk to you about stress and lifestyle management issues. Today, I wanted to discuss what is heavy drinking. Before I define it for you, though, I wanted to tell you why I think it's important. Chronic alcohol use can result in all kinds of medical problems, including increased risk of certain types of cancers like mouth cancers, colon cancer, breast cancer, ladies, prostate cancer. It can also increase your blood pressure, and it dehydrates us. It can make us look older because as your skin dries, then we get wrinkles. So if you're vain, like me, and you don't want to look 60 when you're 50, you got to cut back on the alcohol. So some of this you may have already known. The key is, what actually is heavy drinking? When studies report that, well, how are they defining that? Well, clinically speaking, heavy drinking is considered more than 2 drinks every night for a man, or more than 1 drink every day for a woman. So what is a drink? Well, for hard liquor, it would be 1.5 ounces. So here's the shot glasses, here's about 1.5 ounces. Then for beer, it would be a 12-ounce serving of beer. So here's a 12-ounce bottle. Now this is pretty easy to figure out because you can just read it on the bottle. The tricky part comes with wine. It's pretty common or pretty typical for people to have a glass of wine in the evening with dinner. But what's a glass? Well, for our purposes of defining a glass of wine, it would be 5 ounces. So here's an example of 5 ounces of wine. Fairly small glass and 5 ounces of wine. Okay. But in our culture of supersizing fries and supersizing our plates, we supersize our glasses as well. So here's a larger glass, also with 5 ounces of wine in it. See? Is this what your glass looks like, ladies, when you get it? Huh? Well, here's another glass. Does it look more like this? Now, this is respectable. It's only about halfway, a little more than halfway full. It doesn't spill when you move your arm. What's the problem? Well, actually, this is 10 ounces of wine, double the amount you should have. So here for comparison, here is the 5 ounces, same size glass, and this is 10 ounces. So if you are a woman and you drink 1 of these every night, you're a heavy drinker. If you're a man and you drink 1 of these, 1.5 of these, so you drink this and then maybe fill it up a little bit more for a little bit more, you're a heavy drinker. So what do I suggest you do? Well, I suggest that either one, you could just don't drink every night, but you still want to get an idea of how much you actually are taking in. So it's a good idea to see what 5 ounces looks like in your glasses. 4 ounces equals 1/2 cup. So just take, regular measuring cup, fill it up, and 1/2 cup, pour it in your glass, and then you've got 4 ounces. Take 1/4 cup, fill it halfway, pour it in your glass, and then you've got your extra ounce. And then you can see what your glass looks like with 5 ounces of wine in it. So, good luck to you. Thanks for listening.